I wasn't howling. No, I wasn't. I have allergies. See? And before you ask, no, I was not lamenting about the fact that I failed my practical exam again. I really thought they said third time is the charm. It turns out it's not. Oh. What are you doing in here? Are you lost? It's kind of a private study room. I booked it for the next 3 hours, by the way. Not to cry and not to howl. Because that's a weird thing to say, isn't it? Seriously though, are you lost? Because I don't recognize you. Ears? I don't have ears. I mean, like, just some regular old human ears. I mean, just regular ears. Not anything suspicious. I did put on the charm today, right? Yeah, okay, so it should be working. You can see this? You can see this? You can see this? Hold on. With your consent, do I have your permission to sniff you? I do? Good. Hold on one moment. Oh, you smell very interesting. No, I'm not saying you have body odor. I mean, everyone has body odor. It's nothing to be ashamed about. I mean, it's just your particular scent is a little weird. Like at the soul level, it smells a little rotten, which is like very unusual for even like most supernatural creatures. But also, like above the rotten smell, there's a smell of human. So, does that mean you're a human? How do you see me? See, you shouldn't be able to see me. I'm wearing my charm. Like you would see me, obviously, because like I'm standing right here in front of you. It's just you shouldn't be able to see all of this. You know what I'm saying? And you are human. Do you have magic, perhaps? Not a magic user. Okay. Well, that didn't answer my question. Did you just sniff me back? Without my consent? No, that's not how wolves greet each other. No, we're civilized people. Do you think I'm a beast? That was very forward of you. It was really quite lewd. And we just met. Are you going to take responsibility for what you just did? Nothing? Well, that is... I can tell you're not a supernatural creature because that would have been... Oh, calm down. It's just a normal, rotten human. You're not rotten. No, you're, well, quite a rude human. If I do say so myself, though I don't have a lot of, repertoire with humans. Actually, I've been told I have very bad repertoire with, like, everyone with patients. I apparently come up as a little too, intense and or clumsy, which is what my professor wrote on my practical exam. Everything else was great. It's just everything else was wrong, which apparently is a bigger deal than I really thought. Oh yeah, no, loads of supernatural creatures actually go to this college. There's like a subsection for us. Yeah, we take some like classes with you guys, and then as we progress further through our tracks, we go to more like specialized courses. Yeah, no, loads of them, like werewolves, sirens. There's a few goblins really breaking, the borders. It's pretty crazy, right? Anyone else I can think of? I mean, that's kind of it for this general area. Like different places have, more of a supernatural creature, like leprechauns. Those kind of tend to stay around Ireland and Europe in general. Um, so not too many leprechauns down here. That's a weird question to ask. Do I have No, we don't have vampires. In fact, most places don't have vampires. Did you not know that? They're not like overly common, and sometime in the past like millennia, like they just like stopped making more vampires. Yeah, kind of weird. I guess they kind of like to be very elite, so very few of them like ever are actually around now that I think about it. Werewolves are much more common. You know that? You know that. Of course you know that. I mean, you see me. You went to a clinic? Like a werewolf clinic. You were able to see that? By chance, what was the name of this clinic? Full Moon Clinic. Of course it was. Of course it was. Yeah, that's my mom's clinic. Long line of moons at the Full Moon Clinic as doctors. That's gonna be me one day. Maybe. If I pass my practical exam. I'm sorry, I did a smell before introducing myself again. We're trying to become more civilized. Anyway, it is nice to make your acquaintance. I'm Luna Moon. Wow, I've never heard that one before. You don't say. My name means moon. So funny. I love my mom for naming me that. It's super great, especially around other werewolves who just think it's the funniest thing, and now a human is telling me it's the funniest thing. Actually, well, since you were so rude to me earlier, don't even know proper werewolf etiquette, and you're not busy, right? Right? Well then, to get me to forgive you, you have to be my patient. Please, I really need to pass this practical exam. I get everything written correct, it's just the second part that really throws me off, so I could really use a practice buddy. You will? Thank you. Though, as a warning, I've never treated a human before. I mean, again, we don't really do that in our line of work being werewolf doctors. Speaking of that, how did you even get into the clinic? I bet you had to pay an ear and a fang, huh? It was in your network? Seriously? You have to be lying. You have to be lying. Let me see. Let me see. Oh, dang. That really is in our network. How did you get this insurance? As a human? Somebody signed you up for it, huh? You can have that back. How strange. Huh. Well, besides that being really, really weird, I'm gonna do my best to not be insensitive to your plight of being human. So, if ever I say something that is offensive, just let me know and I will correct it. Because maybe I will be treating humans in the future, seeing as somehow they can get insurance that works with our clinics. Okay. Good. Okay. Don't move. I'm gonna go get a few things. I can do this. I can do this. I'm gonna be a doctor. Okay, be right back. Hello. Oh, sorry. I tripped. So I'm gonna read off the script that the practical exam goes off of, if you don't mind. So, it's going to sound a little bit sterile, maybe, but I'm going to try my best to make it feel natural, like I do this every day. Okay? So just play along. Okay? Okay, good. Hello, patient. How are we, today? This evening? This morning? Today. How are we doing today? Ah, I see. That seems very difficult for you. That's not natural, is it? Okay. Then what do I say instead? I don't know. I'm not really a people person most of the time. I like to try, but, I don't know. It's really hard for me to, gauge how people feel. Unless it's that time of the month. Well, that's rude. I wasn't talking about that. That's a whole separate thing. I was talking about, full moons. You can always tell. We tend to start getting a little bit more aggressive. And then usually there's a couple of days where we just kind of have to sequester ourselves so we don't try to go after, prey, which we kind of start viewing as humans. That was probably too much information, huh? Sorry. Anyway, okay, you can do this, Just be natural, I am sorry that you're feeling poorly. I'm here to make sure that you get the help that you need. And make sure you feel better. Right? Right, no, self-confidence. Right, I'm here to make sure you feel better. Because I'm a doctor. I'm pre-med. I'm going to be a doctor. So, patient, why are we here? That's right, I need my chart. I know I have my chart. Hold on. Oh god, I would already be docked 5 points for this. I found it. It's a fake chart, by the way. Tell me, patient, what are we in for today? And I'm supposed to pretend to listen to you? Oh, it keeps getting caught on the stethoscope. I'm supposed to pretend to listen to you, but I actually read the chart, which already tells me why you're in here. That part's supposed to be quiet. Yeah, okay. No, I got that. Okay. So, patient, tell me why we're in here. Ah, I see. You're feeling unwell? Got it. No, and I'm gonna pretend to write that you feel unwell, even though the chart normally says that you feel unwell. That's already... Again, subtext. Got it. Okay, and, can I please, verify your name, patient? Conduit. That's a weird name, but I'm not here to judge. I'm a doctor, and I'm supposed to not judge anyone based on type of supernatural creature or not supernatural creature, age, or gender. Okay, even though you smell a little rotten. So again, I'm here to treat you. And do I have your consent to sniff you? More natural. May I have your permission to sniff you, please? Even though I've already done it, but like this is the exam. I know I'm really bad at it. You see why I failed? Third time's the charm. Not for me. Maybe fourth. So I'm gonna write down. Normally this is the part where I'd sniff you. I'd go, and please do not sniff me back. That is just for future reference. You have to ask permission. Okay, that's a very private thing about people. We're able to sniff out infections and how people are feeling, their overall health, So, in the future, don't go up to random werewolves and sniff them. It's not a greeting. It's not what you think. Got it. Okay. So I'm gonna write down smells rotten, but not unwell. But for this scenario, pretend to be sick. Achoo, achoo, achoo. You're a really bad actor. Oh, you've been practicing. Do you have experience with this before? Go back to the drawing board. But I appreciate the enthusiasm. But I'm a bad actress too, so, same. Maybe let's just start with some deep breathing. This is not part of it, but I think it will help me not be as anxious. Okay? Okay, just in and then out. Yeah, no. In and then out. That's better, right? It's better. Okay. Now we're both more relaxed. We're doing great. You and me. Alright, so you're feeling unwell. I've already done the sniff test. Now, can I ask about your particular eating habits? What is your diet like? Really? Is that a normal human diet or is that a you diet? Okay. That's fine. I would recommend more raw meat for the iron and nutrients. It would probably also help with any lethargicness, lethargic. You understand what I'm saying? But general, just being tired. It would help with that. Great source of nutrients. Is there anything else that you usually partake in? Okay. And how many? Oh, okay. Again, you should eat more balanced meals. But you're not here for that. Anything else? That's a lot of cheese. Any particular? A very good friend eats a lot of cheese. Got it. You should tell them not to. Just in general. Just, pre-med. Or whatever makes them happy. I'm really bad at this, aren't I? No, I appreciate the encouragement. Yes. Doctors. Woo! You can do this. Luna. Okay. Got your diet out of the way. So how do you normally go about catching your food? Have you noticed any changes in your hunting patterns recently? Grocery store. No, I know what those are. We don't go into them, okay? We take pride in catching our food. I mean, sometimes we DoorDash, but like, no, yeah, werewolves have their own separate app for that. You didn't know that? Yes. Yeah, no, sometimes we're lazy, but like, there's usually like a pattern. We're very much like pattern-oriented people, so usually that's an indicator of either something stressing them or like lack of health. Make sense? So grocery store and you hunt there. Got it. Okay. Now, when was the last time you fully shifted? For the sake of this, I know you're human, but like, for the sake of this, never. Now, tell me emotionally, how are we doing? Like, have you noticed any differences in patterns of emotions? Has there anything that has never been a stress aggressor before, but is now being a stress aggressor? Do you find yourself losing control? What do you mean normal doctors don't ask how you're doing emotionally? Like human doctors don't ask that. That seems weird. That's like really important. So like what do they normally tell you when you're feeling stressed or upset or just anything out of the ordinary? For curiosity's sake. They say you're young and you'll get over it because you're young. I'm so sorry. That sounds terrible. This is like a very important step in the process for werewolves. Okay. Well, how are you feeling? A little tired. Okay. That's nothing to be ashamed of, but again, the iron, like, and the less cheese. You're right. I'm not here to harp. I'm a doctor, and I'm here to listen. I'm here to listen and not tell you you're young. I mean, you are young. There's nothing wrong with being older or younger. I'm here to listen and not judge. I'm just writing gibberish because this is an awkward conversation. Yeah. Okay. Now that we're done with that, we haven't shifted and talked about the emotions. Now we're just gonna go over like general hygiene and maintenance and make sure that there is no visible infection where normally patients would exhibit an infection. Okay? Okay, now at any point if I'm too rough or do anything that makes you as a human uncomfortable, just let me know, okay? Okay, good. We're doing this. We're doing so good. Again, I'm sorry if doctors have ever treated you like that. Now that you have insurance for werewolf clinics, I would highly recommend them. But maybe fill out the forms and say like human, or wear a name tag that says you're human. Just so like, they're not caught unawares and think that you're dying. Yeah. Cool. Because they would, by the way, if you showed up without like being able to answer any of these questions, or like you didn't have the things that we normally look for. Okay, good. We don't want any unforeseen circumstances. Wow, I'm gonna be a great doctor. Okay, be right back. Okay, first I'm gonna take your temperature. Yeah, no, it's pretty standard. Is it standard for humans? Yeah, okay. Well, that makes sense. I mean, that's again a good indicator of sickness or like falling of like pulse, like if you're feeling too cold or any general like heart issues. It's a good indicator. Okay. Sorry, this is hard to get out. Claws. Alright. Make sure it's working. Okay, it is. Alright. Now, I'm just gonna put this up, and if they shouldn't hurt, at least I don't think it hurts humans. Does it hurt? No, okay, so my inkling was right. It shouldn't hurt. I'm just gonna put this up to you and count to 5, okay? Okay. 1, 2, 3, 4, 5. Okay. This is not good. No, it says like 96. 97. It says 97. Is that? Because like if this was us, you'd be like on your deathbed. This is not normal. We as werewolves run really high temperatures, so like anything like less than 102 is like, and 102 is like already pretty low, but like could just be you're cold or whatever. But this is average for for humans, just in general. Okay, I'm gonna make note of that. But this is okay. This is good. It's good. All right. And would you mind if I just like felt your pulse real quick? Okay. Yeah. No, you could just give me your hand. I'm gonna go to your wrist real quick. Okay. No, we're able to pick up senses really, easily. It's part of what makes hunting a little bit easier. No, just relax. Okay. And take a few deep breaths. Try to remain calm and relaxed. Okay. Is that normal? Okay, it is normal. Alright, because that was really slow. Normally it would be much higher. Okay, now that's good. So baselines are okay, I think. Again, I study supernatural creatures, not humans, so I'm just gonna take you for your word. How was that interaction? Did you feel relaxed? Was it too hard? Was I not being emotional enough? Did I show the right amount of caring and professional? I looked scared. Okay. I'm gonna make a note of that. Thanks. Ooh. That's usually par for the course. I don't know, I'm always afraid I'm gonna mess up, and then I start, going on and on and on in my head, like, oh my gosh, I'm messing up, oh no, I'm gonna get points marked off. I have really bad test anxiety. If it wasn't obvious. Was it obvious? Do humans suffer from test anxieties too? They do. Okay. More I think about it. That's right. Let me write this down. All right. Pulse. Normal-ish. Normal-ish. Yes, that is professional jargon. And temperature is average for a human. 97. Okay. Got it. So far, this is going pretty well, right? There's room for improvement. Okay. Now, next, I'm just going to take a quick look at your hands, if you don't mind. Yeah, specifically your nails. It's standard procedure. Do you guys not do that? nails can be a really big indicator of like overall health and hygiene, right? Human doctors are weird. Okay. Alrighty. Good? Yep, well, you can just give me any hand that makes you comfortable. Alrighty, let's just see. I'm just gonna look around the cuticles. And look, no, I'm sorry, am I being too rough? Am I being too rough? Okay. Sorry, I'm sorry. I'm so sorry. And then I'm just trying to, are your nails normally this color? Okay, that's average. And what happens if I just press? You don't feel any tingling, any numbness? Color change looks relatively normal. I don't see any signs of infection. No yellowing. Okay. Let me look on the other side. You're doing good. Looks relatively clean. Again, no signs of infection. And you clean them relatively well. That's really good. I mean, I guess you don't really deal with live prey that often. It's important to keep things clean. You only make that mistake once. Okay. I don't notice any like purpling. Again, no sign of infection. Alrighty, if you want to hold up your hands for me. Okay, and if you can just squeeze. That's good. And if you can just unsheath your claws. You don't have those. Okay, I guess that means general health of your nails / claws are good, which is a good positive sign. Next, if I can just take a look at your teeth. Again, a very nice, serious indicator on overall health and hygiene. You guys have to go to a separate doctor for that? That's weird. No, we just kind of have like a all-in-one situation. Like, we have specialists, obviously, but I think our make of teeth, the composition is a little bit different, a little bit stronger than I'm assuming humans. rough gig for you. Okay. If you can just open up your mouth for me. Thank you. Okay. That's good. Okay. Can you? Okay. And do you notice any like pain or any swelling? No. I don't feel any pain or swelling either. And again, you haven't noticed any like pain while chewing, swallowing any particular foods? No. Okay. What about any temperature of food? Okay. No. So that's good. Good. Weird that you don't have. It's fine. It's fine. Usually the back of our teeth are a little bit sharper. It allows us to like grind and tear things a little bit easier, but I guess humans have more of a plant, or I guess in your case, cheese-based diet. Again, not here to judge. I'm not judging. I am impartial and emotional. How was that? As soon as I start to think I'm being graded, it kind of goes off the deep end. Let me write this down real quick. Humans are strange. I'm not gonna write that part down. I'm gonna you know. You know. Okay. I'm not writing down humans are strange like promise, but I am writing overall nail health is okay, and overall teeth health are good. Oh, based on your diet, obviously. Now, last thing, I just want to take a quick look at your sense of smell, if you would allow. Again, this is very important to us werewolves. You know, a lot of this whole cavity, at least in werewolves, I can't say the same for humans, are all connected. Like ears, nose, you know, sense of taste. It's all connected, so it's pretty important. And it is how we track down our prey, so. Good, okay. Now, these scents are going to be a bit strong, but I just want you to tell me approximately, like, what you smell, okay? Good. All right. One question that I forgot to ask, if you don't mind. Do you, would you mind if I saw your gloves? Yeah, like your day-to-day gloves. I want to make sure that they're well maintained. Humans don't carry around gloves. No, it's not for like cold. It's in case we touch silver. So we have insulated gloves that we all carry around and wear. But you want to make sure that they're well maintained because you don't want any accidental silver poisoning or any burns. Also for any accidental shiftings, so for nails, we're able to hide them a little bit easier. In case the charm fails, but also just like in general. It makes sense you're not allergic to silver. It's just a question that I'm supposed to ask. Again, that's not a joking matter. You'd be surprised, a lot of things are like silver plated, silver coated, and you can never be too sure, you know? So if you notice anyone wearing gloves, now you know why. I mean, maybe the ears would give it away, but it's good, it's good. We're learning more about each other, human to werewolf. Yes, let me go get my last test, if you wouldn't mind. By the way, if you're free later, maybe I can run a few more one thing at a time, Luna. Sorry, I get ahead of myself. I also get marked down for that in the testing, too. Fourth time is the charm. Am I right, or am I right? That's right, the sniff test. Okay. Alright, now again, these should be relatively pungent, but you just like approximately kind of tell me what you smell, okay? Okay, they should be relatively easy. Alright. If you want to just quick give that a smell. That is completely wrong. Yeah, no. But, you know, I'll give it to you. It was a flower. Specifically, it was rose. You don't smell that? It's really pungent. You don't? Are you sure? Is your nose working properly? Because I can smell this like from over there. You don't smell it? I mean, they are dried. Human noses aren't as sensitive. That makes a lot of sense. Still good on you for trying. It must be hard. Just being human. Is it? I mean, I guess you don't have to worry about silver, but you can't smell this, you know, the like drawbacks. Sorry, was that insensitive? A little. Okay. I'll make a mental note. I'm getting better now. One more, if you don't mind. Maybe you'll get this one. This one's gonna be extra pungent. Like, good. Yay. Alrighty, this should be very pungent. It's, you know, because of Oh, you'll figure it out. You'll figure it out. But, ooh, this one was territorial, if you know what I'm saying. I mean, they tend to be, you know, if they haven't found their, like, permanent homes. Here I am, just giving it away. Hold on. Let me just open it for you. Oh, it really is pungent. I'm sorry. Okay, give this one a smell for me. You don't smell this? I smell it. Are you sure? Seriously, you don't smell that? This is from a gnome burrow. They pack it with different dried, you know, dried mosses and dried leaves and such. But they tend to mark their territory for their little burrows, the gnomes, before they found their permanent residence. So this was taken from a burrow actually quite near here. Have you ever met a gnome? A pocket gnome. Many pocket gnomes. Just the one pocket gnome, but like other gnomes. Fascinating. Do you think I could meet them? No, you're getting ahead of yourself, Luna. You always do this. It's just normally gnomes and werewolves also don't get along, but I mean, truthfully, gnomes don't get along with most supernatural creatures. They tend to prefer like humans, and then they live in their homes. They clean, but you know, once they found their forever home, they don't leave. I wish I could have a gnome, but they don't like me. Not me as a person, just me as a werewolf, maybe as a person. I don't know. I tend to overthink a lot. I can't believe you didn't smell this. It's okay. It's a lot. It's a lot. It's a lot. Anyway, I'm not sure if your nose is in working order, but you know, I'll write it down anyway. Okay, I'll just write down nose is maybe working. Yeah, no, there's much more to this exam if you do mind. You're meeting someone, you're meeting them at a cafe for tea or coffee or hot chocolate. I don't know. I'm just assuming. Makes sense. You seem like you'd be really popular. I mean, you're already kind enough to spend all this time with me. Luna Moon. Future MD. Do you mind if I tag along? Your friend doesn't like other people. No, I totally get it. I totally get it. Maybe next time we can continue this exam. Yeah, I tend to like using this study room a lot. So if you ever find yourself, you know, with some free time and you don't mind helping out a poor werewolf in distress, you know, stop on by. Or if you're just lonely, that's cool too. No, I get it. You're running late. You're running late. Well, thank you for agreeing to help me. I appreciate it. Yeah, no, totally. Have a great time. Bye. Wow, my first human friend. This is so great. I'm gonna have to tell my mom.